The coagulation cascade is a complex series of events that leads to the formation of a blood clot. This intricate process ensures that bleeding is effectively halted, creating a protective barrier at injury sites. Understanding the differences between the intrinsic and extrinsic pathways within this cascade is essential for appreciating how our body responds to vascular damage. The intrinsic pathway is triggered by damage to the blood vessel's endothelial lining, allowing factors already present in the bloodstream to become activated. This pathway is slower, showcasing a sequence of activations involving clotting factors like TUZ, ET, 9, and 8, ultimately leading to the activation of factor X. The intrinsic pathway is crucial for amplifying the coagulation response, ensuring that clotting agents respond adequately to a significant injury, maintaining hemostasis over time. In contrast, the extrinsic pathway is initiated almost immediately following vascular injury, providing a rapid response to bleeding. Triggered by tissue factor, TF, which is released from damaged tissues, the extrinsic pathway activates factor 7. This factor then combines with tissue factor to activate factor X. This pathway stands out for its speed, underscoring the body's ability to respond quickly to immediate threats. Together, both pathways converge on a common pathway, culminating in the formation of a stable fibrin clot, essential for stopping blood loss and starting the healing process. A key distinction lies in the components and timing of activation. The intrinsic pathway relies on agents present in the blood itself and acts over a longer time, while the extrinsic pathway operates swiftly and is reliant on external triggers from surrounding tissues. The intrinsic is often likened to a slow burn, whereas the extrinsic is akin to a flash of lightning, swift, immediate, and directly responding to injury. Both pathways, while different in mechanism and speed, are crucial in forming a coordinated response to injury, ensuring that blood clotting occurs efficiently and effectively. Understanding these pathways provides insight not only into the body's natural healing processes, but also into various medical conditions and treatments. Disorders of coagulation can lead to excessive bleeding or unwanted clot formation, illustrating the need for a balanced cascade. This knowledge is vital for developing targeted therapies that can manage clotting disorders, ensuring that our body can maintain normal function while effectively managing potential threats to vascular integrity. Overall, the coagulation cascade is a testament to the body's remarkable ability to heal and protect itself from injury.